Hello everyone, today we are going to talk about Buerger's disease. Have you ever felt tingling or numbness in your hands or feet? Or that your hand or feet are pale or blue in color? These symptoms may indicate a disease called Buerger's disease. Did you know that this disease occurs more often in smokers than in non-smokers? Buerger's disease is a rare disease of the arteries and fades in the arm and legs. In Buerger's disease, in which your blood vessels become inflamed, swell, and can become blocked with blood clots. In this video, the doctor will explain what Buerger's disease is, its symptoms, and how it is diagnosed and treated. Our role today is to answer most of your questions regarding Buerger's disease. Today we have Doctor Gwon, who is a leading doctor at Korea University Anam Hospital. He's going to discuss with us everything about Buerger's disease from an experienced medical point of view. Hi, I'm Ume. Before we start, please subscribe to our channel so the next time you'll be updated with our new releases. Hello, Dr. Gwon.
Yeah,
nice to meet you. Can you please briefly present yourself?
I am Gwon Junjio, a vascular surgeon at Korea University Anam Hospital. Nice to meet you.
Nice to meet you. So today we'll be talking about first the Buerger disease. So what is exactly Thromboangiitis Obliterans and which vessels are affected by this disease?
Thromboangiitis Obliterans is more commonly known as Buerger's disease. Buerger's disease is a disease that affects the end of the body, such as hands and feet. Buerger's disease is mainly a disease that destroys blood vessels at the fingertips and toes.
So what are usually the symptoms for Buerger's disease?
Since Buerger's disease invades blood vessels, ischemia symptoms that do not flow blood usually occur. As a result, hands and feet become cold, pale, and patients feel pain. When the disease invades the blood vessels of the leg, it is characterized by a crippled symptom of causing pain when walking.
So what are usually the causes for this disease? Are there like bad habits, or is it related to heredity, for example?
Risk factors that cause vascular disease include blood pressure, diabetes, hyperlipidemia, and smoking. In Buerger's disease, smoking is the biggest risk factor. Unlike other vascular diseases, which usually occurs in elderly patients, Buerger's disease is more common in people in their 30s and 40s, and more common in men than in women. In addition, there is a peculiarity that the disease does not worsen if the patient stops smoking when you have Buerger's disease.
So what are the methods of diagnosis of Buerger's disease?
One of the biggest features of Buerger's disease is that collateral blood vessels develop well. And when the patient is photographed, a peculiar symptom called corkscrew is found. The most reliable and definite test is CT angiography.
Can you talk to us a little bit more in details about the modern medical or surgical treatments?
Buerger's disease medical treatment includes prescriptions for drugs such as antiplatelet drugs. Additionally, drugs that expand blood vessels are also used. Like vascular disease, percutaneous angioplasty, which pierces blood vessels, again when blood vessels are blocked, is mainly used as a surgical treatment. And in some cases, bypass surgery is also performed.
So Buerger's disease, does it have certain complications on the legs?
When blood vessels are blocked, ischemic symptoms appear, and necrosis progresses when ischemic symptoms appear on the fingertips and toes. So one of the most frightening complications is that the fingertips and toes have to be amputated.
Okay, so last question about Buerger's disease. Is there any way to prevent it?
As I said earlier, smoking cessation is the most important thing for prevention. It is also important to detect diseases early and correct lifestyle habits or receive medical treatment.
Okay, perfect. So today we learned many things about Buerger's disease, and the doctor explained in details everything related to its possible causes, symptoms, how it is diagnosed and treated. Thank you for joining us once again today at CloudHospital TV. If you have any questions or comments, please leave them below and we'll respond to you as soon as possible.